lateral compartment tests. First would be the jump sign by pressing on the patient's outside lateral portion of her hip. A positive would be the patient jumping, and that would be positive for bursitis. Then straight leg raise test, patient would be laying backwards, supine, lifting her straight leg up past 30 degrees. If there was pain or reproduction of symptoms down her leg, they'd be indicative of a lumbar radiculopathy. Ober's test, patient is going to lie lateral recumbent and going to have the leg straight, abducted, and you may see either extension or flexion, both are correct. A positive test for this would look like the leg staying straight up or ratcheting down, and that's because we have a tight IT band here holding that up. The next would be Trendelenburg Tests. So patient lifts one leg, and normally everything should stay straight in the hips, but if there was weak muscles on the side here or something going on with the nerves, the hip would drop to that side, and that would be a positive test. Next test, Piriformis Test, will be the patient lying supine. She will be making a figure 4 with her ankle going over the top, now flexing up her hip, and she will push back on this hand of mine, and a positive test would be pain in the gluteal region, and which would be a positive for piriformis pathology. And last would be the Faber's test, where patient is put in the figure 4 position, stabilizing the opposite hip, but this time the patient will be pulling down on this hand.